Hi, Sal here from Barefoot Physiotherapy in Brisbane, and I am teaching you today about sciatica. So sciatica is something that you may well have heard of, and it may have quite a scary and negative connotation, so I just want to make sure that you understand the different realms of it. Okay, so just because someone has sciatica does not mean they need surgery. All right, in very extreme cases where there is large amounts of radiating pain down the leg, no back pain, and an orthopedic surgeon or neurosurgeon makes the call, surgery is required. In all other situations of irritation of the sciatic nerve, because that's what sciatica is, so irritation of the nerve that comes out of your back, down your leg, and right down to your foot. Irritation of that nerve is sciatica, and it responds really well to conservative treatment. So that severe irritation and inflammation, even that can respond really well to conservative treatment, and the education and advice that your physios and doctors give you is really paramount. So things that you might feel that might not be that extreme pain, because you can have that with sciatica, but you can also have feelings of pins and needles, numbness, one leg feeling tighter than the other, especially down the back, and a bit of a feeling of unevenness. These are things that might be indicative that you have this. So a protective response of the body is, so when that nerve, so it comes out of the back and down the leg, when it's irritated, the muscles spasm up to protect the nerve, okay? Now nerves are the things that the body wants to protect the most. So the muscles spasm up and you will feel that tightness often. You might get a change in your pattern, like your walking pattern. But the other thing to make note of is this change, this tightness, this alteration can build up strain elsewhere. So you might not necessarily feel so much down your leg. It might be a bit uneven, might be a bit tight down your leg, but you might feel it more higher up in your body. But it's because of that pattern building up, that strain building up down your leg, that it builds the strain elsewhere. So what do we check? We check neurodynamic tests. This is our absolute mainstay of assessment here at Barefoot Physiotherapy. It's the first thing we do in every session with every client. So we test how that nerve travels out down that leg and how it's moving compared to, so when the nerve's on tension compared to off tension, and if it is more reactive on tension, your nerve is irritated, okay? What we do then is we treat it. So we use gentle hands-on treatment, and majority of physiotherapists and different types of hands-on therapists will have techniques for this as well. We also use our what we call R1 measurements. So our NDT is that nerve test. Our R1 is movement test. So we look for the first response of the body to be reactive. So R1, reactive 1, R2, reactive 2, P1, pain 1, P2, pain 2. So we're looking for the body's first indication that it's not happy to do that movement, because if we are testing you, sometimes repeatedly within a session, we don't want to flare you up, so we use R1, objective, and doesn't flare you up. Now, it's important to note that this is quite general advice. So if you have any symptoms that are down your leg, they are things that should be checked by a health professional. Especially if you have any bilateral pins and needles, or you're having any difficulty or feelings through your groin. These are things that do need to be checked. The main takeaway from what I'm telling you today is that sciatica doesn't need to be scary, okay? Majority of people recover fully, and they recover without surgery, which is an absolutely fantastic response. Thank you very much.